Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist. This is a technique that just because you're using a tool doesn't mean you have to use more pressure, or that just because you're using a tool, this means this is really heavy work. It's not. It can be, but you can use light pressure with a tool, you can use heavy pressure with a tool. What it allows you to do, though, we saw in the skeleton, there seemed to be a lot of space between the tip and the transverse process. Where'd that space go? It's filled in with muscle. And one of the attachments on there, the most superficial one, is the upper trapezius. So here's the technique. It's good to stabilize with the other thumb. So pressure, relax. Pressure, relax. Is that pressure okay? And pressure, relax. So I'll do that 3 or 4 times. Move down to the next segment. You really need to feel the spine. 45-degree angle. Pressure, relax. Pressure, relax. Now it doesn't matter if you do the pressure in this direction and relax coming the other direction or that, but whatever is comfortable for you depending on which hand you're using. So the other thumb is kind of the locator of the spine and the guide. And if any of these are particularly sensitive, let me know, because you can also use this to treat trigger points. So if I'm going in at this 45-degree angle, and she says, well, that one's really tender, then I'll stop and treat it with ischemic compression. But just 3 or 4 times per segment. And notice this thumb is there so that if the back is slippery, I don't slide off. So it's a stabilizer. Now, if you were just isolating the trapezius, like let's say the person, theoretically, every other muscle in their body was fine, but they had a trapezius that was injured in a car accident, you might stop there. You will see when we do the erector spinae, we do exactly the same technique and just take it all the way down to the sacrum, even onto the sacrum. But right now we're only talking about the trapezius. Now you might think, well, gee, you left all these red marks and all these lines in her. That's normal. Okay. So because it's a very precise tip, it gets very deeply into the tissue and allows you to do things you can't do with your hands. But please don't use more pressure than your client can tolerate.